Hi, I'm Dr. Sean Van Winkle with Integrated Brain Centers in Denver, Colorado. We help people recover from concussions regardless of how long ago it occurred or how many they have had. In this video, I'm going to share with you the long-term effects of a concussion on your brain and health. Every concussion and traumatic brain injury is unique. Severity of the concussion, location of damage in the brain, history of multiple concussions, and the overall state of health of the patient will often determine the rate and quality of recovery. For many patients, they will experience long-term effects from the head injury and may even be at risk for developing early dementia, Alzheimer's disease, or Parkinson's disease later in life. When someone has a concussion, the brain and the immune system immediately go to work to try to repair the damage. Areas of the brain that have been damaged will release chemicals that cause the immune system to increase inflammation. During this process, some cells survive and some do not. The ones that do not will leave debris that the immune system has to clean up. The brain will then attempt to develop strategies to adapt to the loss of tissue. For cells that are weak after the injury, the brain will attempt to stimulate them to try to make them stronger again. In many cases, especially milder injuries, the brain is very successful at adapting and people will often recover from their symptoms. In more severe cases, or when there is a history of multiple head injuries, the brain may enter a state of chronic inflammation. The immune system in the brain is very different than the immune system in the body. In the body, the immune system is more complex and is modulated by many different factors. In the brain, it is much simpler. If there is damage to tissue in the brain, the immune system can often overreact. One of my favorite analogies describing the immune system in the brain is that it is like a chihuahua with a bazooka. When the immune system overreacts like this, it can cause a lot of collateral damage. When this process goes unchecked for a long time, it can lead to early degeneration of the brain, as is seen in dementia, Alzheimer's, and Parkinson's. As the immune system continues to affect undamaged tissue, the brain will gradually lose the ability to adapt to new damage. Patients may have unresolved symptoms or may notice early declines in cognition, mood, behavior, vision, sensory, and motor function. As foreboding as this may all seem, know that there is hope. There are three very important things you can do to slow down, stop, and in some cases reverse this process. The first one is related to changing your diet. Diets such as Paleolithic diets are designed to be anti-inflammatory and promote stable blood sugar. This type of diet can help reduce the overactivity of the immune system while providing the nutrients the brain needs to repair itself. The second thing you can do to help your brain is to exercise it. One of the most potent ways to decrease the inflammatory responses in the brain is to stimulate the damaged cells. This situation, however, is very much like the story of Goldilocks and the Three Bears. The cells need an amount of stimulation that is just right. Too little stimulation to the cell and it won't release the right chemicals that tell the immune system to calm down. Too much stimulation will result in the cells releasing more inflammatory chemicals, causing the immune system to stay in hyperdrive. This is why it is important to work with a professional who is expertly trained and experienced with the rehabilitation of brain injuries. The third thing you can do to reduce your risk of early degeneration is seek help as soon as you can. When damage progresses far enough, sometimes the process cannot be reversed. In these cases, it is still very important to seek treatment that can help slow down and often stop the damage. You have now learned what some of the long-term effects of a concussion on the brain are. At Integrated Brain Centers, we can do a comprehensive evaluation to determine if you are at risk for early degeneration of brain function. Please contact our office at the number you see on the screen to see how our office can help you.